so the biggest challenge for individuals with autism spectrum disorder is social communication. Some of these examples are behavioral emotional regulation, which is specifically the behavior of the child or individual with autism spectrum disorder, and the emotional part is that they do not understand others' feelings well. The play skills can make it extremely difficult for a child with autism to interact with other children without disabilities because, for instance, they do not know how to play pretend. They don't know how to play make-believe, so that can make it extremely difficult. Nonverbal behavior, they do not hold eye contact well. Joint attention, they may not understand what you're referring to if you're not specific. They won't follow your gaze. They won't follow your gestures. They're not going to follow what you're referring to. Social reciprocity is pretty much turn-taking in a conversation. They don't understand in a conversation that you have to take turns and you have to let the other one talk. So they may interrupt you and talk the whole time and never give you a chance. With speech, one sign of possible autism spectrum disorder is that the child will talk at a much later age than a child without the disability. 15% of individuals with autism spectrum disorder have a speech disorder. 30% of individuals with autism spectrum disorder are completely nonverbal, which means consistently they have no words until the age of 9 years old. Pragmatics is one of the worst impaired parts of autism spectrum disorder. And language skills is usually the first warning sign of autism spectrum disorder. And we specifically come into play with semantics, grammar, social reciprocity, pragmatics, and working with the child to better communicate. Okay, now we move on to the diagnosis of autism spectrum disorder. And here is a quote from Asha. The SLP, who has been trained in the clinical criteria for ASD, as well as in the use of reliable and valid diagnostic and assessment tools for individuals with ASD, and who is experienced in diagnosis of developmental disorders, may be qualified to diagnose these disorders as an independent professional. Pretty much what that means is not every speech-language pathologist can diagnose autism. You have to be specifically trained in a certain area. But we play a critical role in the diagnosis of autism spectrum disorder. There's what's called an interdisciplinary team to diagnose autism spectrum disorder. We're part of it along with psychologists, the educators of the child at risk for autism, the neurologists, audiologists, and occupational therapists. Now I move on to the assessment of a child who's at risk for autism spectrum disorder. It's going to focus specifically on the functional abilities, behavioral components, and current level of functioning of the child at risk. In the assessment, there's a communication assessment, a speech assessment, and a language assessment. For instance, the communication assessment is going to work on seeing if there's a speech disorder. It's going to see if there's an expressive receptive disorder. Anything that we find in the assessment is going to help us know what we need to treat and intervention. When we are assessing a child and we're doing a diagnostic evaluation who is at risk for autism spectrum disorder, we look at direct behavior observation, relevant background information, health history of the family, and the health, developmental, and behavioral history of the child. Pretty much, we want to know what has gone on in their life. We want to know what happened whenever they were in the womb. We want to know everything about their environment. Okay, now we move on to treatment of autism spectrum disorder. The goal of intervention is development and application of functional skills necessary to live as independently as possible within a community. Pretty much, we want an individual who is impaired with autism spectrum disorder to live as normal as they can. Types of intervention. There are some types of medication. There's behavioral approach, which goes straight to the source, to the behavior. It treats the behavior of a child with autism spectrum disorder. A natural teaching approach, which is pretty much going to be treatment inside the natural home of the child. Peer training is going to help any children, anyone who is around a child with autism spectrum disorder, learn how to interact with that child with the disability. And the pivotal response training is going to focus on a wide variety of things, such as personal responsibility, communication skills, just a wide variety of things that a child with autism spectrum disorder needs to have worked on. Types of treatment. There's medication, dietary approaches, complementary and alternative medicine, and their behavior and communication approaches. Pretty much, early intervention treatment services can greatly improve a child's development. You want to get it diagnosed as soon as possible, and you want to start treatment and intervention as soon as possible for a child with autism spectrum disorder.